So the future for telehealth reimbursement is a really good question, and we've been trying to find the true answer to that. I think during the pandemic, our private insurers such as Blue Cross Blue Shield, United Healthcare, they did a phenomenal job of stepping up and reimbursing telehealth very well. Medicaid did a really good job of reimbursing, and of course Medicare through the federal government did. And we are in a wait and see sort of mode. We have reached out to our private insurers. We've had multiple phone calls with Medicaid, trying to make sure that they have the data they need that justifies the need for continued reimbursement for telehealth. We've done a really good job of getting our healthcare providers to the table to install the equipment to expand their telehealth service lines because they were getting paid. They cannot provide services that they do not get reimbursed for. We can't go back and yank that away from them. If we do, instead of being 10 years moving forward, which is where we have been the last couple of years, we're going to push ourselves back.
We all have an important role to play in ensuring that telehealth becomes a permanent modality. Remember that when I say telehealth, it is audio only, just speaking on the phone with your clinician. It's audio video, it's chat, it's what we call store and forward. It is a number of different modalities. Remote monitoring, the ability to have your doctor have a monitor on you and know if something's not going very well. So telehealth in all its forms should be a permanent fixture. And our opportunity is to remind our publicly elected officials, both at the federal and state level, that you want to have access to these services even after the public health emergency. When the public health emergency goes away, telehealth has to stay.
I think that the funding for telehealth is going to be an issue, and that's where the politics needs to come in, and they really need to provide funding that is equitable for that service, because it is a service that is much needed, and it's especially needed in rural communities. So we need to make sure that the FQHCs and the rural health clinics are able to bill for these services.
What we're really looking forward to in the future is not necessarily parity laws, but equitable payment for service delivered. So, you know, the idea that we're trying to lower costs, I think it's a fair conversation that some of the benefit of lowering cost, a lot of it needs to go to the patient, some to the providers, and some to the insurance companies. We all need to win in its design. So if you really, you know, we're becoming much more open now that telehealth is established, with the idea that payment doesn't have to be exactly the same, but it should be fair. And that's been a really great conversation, to be honest. Do we all trust each other and all those parties? Probably not, but I think it's a great foundation. So while I do expect more state legislation activity, it might be more focused on fairness, and it might be more focused on making sure the rules aren't too restrictive so that we go back to the dark ages of, you know, pre-large scale telehealth.